Hi, and welcome to the virtual Xavier University of Louisiana's 15th Health Disparities Conference. My name is Rania Berkane. I'm a current postbac student at Charles R. Drew University of Medicine and Science, and I will be presenting my project titled Social Determinants of Health and COVID-19 Vaccine Uptake. To introduce my project, I would like to give some background. Disparities in influenza vaccine uptake among U.S. adults are well documented and may have implications for COVID-19 vaccine uptake. The recent viral outbreaks of COVID-19 and increasing vaccine hesitancy among populations experiencing health disparities highlight the need to develop strategies to improve vaccine uptake and reduce vaccine declination. Research is needed to understand and address factors that promote or inhibit vaccine acceptance among adults in the U.S., especially in populations at increased risk for morbidity and mortality due to long-standing systemic health and social inequities. Two key objectives for our study were to conduct preliminary descriptive analysis of characteristics of patients who have received the COVID-19 vaccine at Harbor-UCLA Medical Center, and secondly, to examine strategies to improve vaccine uptake among patients receiving care within one of the nation's largest safety net healthcare systems. Our design and methods: in order to conduct our study, we recruited patients through Harbor-UCLA Medical Center, and we asked them survey questions that included questions regarding COVID-19 vaccination behaviors, risk perception, trusted sources of data, social determinants of health, as well as recommendations to improve vaccine delivery. Our survey respondents are mostly low-income people of color from South Los Angeles community. Next, I would like to bring your attention to the first table, and that is the sample characteristics of it's a sample characteristics of survey respondents. Out of 148 participants, 58% were female, 42% were male, 65% reported having a high school diploma or below, 56% were unemployed, and approximately 70% made less than $30,000 annually. Our participants were 20% Black, 35% white, 14% Asian, and 24% reported being multiracial, and 70% were also Hispanic. Lastly, the majority of our participants, that is 77%, were uninsured. Next, I would like to delve into the second table. The second table explores COVID-19 related behaviors. 27% of our participants have been previously diagnosed with COVID. 70% have not, while 2% do not know if they were diagnosed with COVID. 75% of our participants that they are not at risk of getting COVID-19, while only 12% perceived to be at risk of being infected. All our participants, that is 100%, received the first dose of COVID-19 vaccine, while also 90% consider getting the COVID-19 vaccine in the future. Next, we looked into the level of social needs for food insecurity, housing instability, and perceived neighborhood safety. Figure 1 here shows those social health factors. It shows that 36% experience food insecurity, while 18% reported having unstable housing, and 14% did not feel safe in their neighborhood. We lastly looked into the suggestions for COVID-19 vaccine uptake improvement, that is figure 2. Our content analysis revealed the overall need to improve risk communication, and that was 45% of the suggestions. Next was that 14% suggested improvement for logistical / access to vaccine. 22% highlighted the need to use social media and the internet to share digestible information. 14% also highlighted the need for more effective communication with providers, and that is by addressing language barriers. And lastly, another suggestion was improving social service benefits, and that was 2%. Here at the bottom are some of the sample answers given, such as more material in Spanish, more info on social media, using pamphlets to educate people, and such. In conclusion, our study reveals a diverse patient population that is primarily low income with low levels of education, high level of COVID-19 vaccine completion rate, as well as a high rate of intent to vaccinate again. We also find that patients recommend the need to improve communication and social services in a safety net healthcare system. Future research is needed to better understand the mechanisms between social determinants of health and vaccine uptake. Lastly, I would like to bring your attention to the acknowledgement section, and thank you so much for listening.